Welcome, everyone, to Coffee and an Interview. I'm Jacqueline Pena, and I'm really excited to have Aimee Rossini here with us today as our guest. She is a health coach who focuses on health literacy. It's a big topic as we look at increasing numbers of chronic diseases and we try to navigate our healthcare system in today's society. So, Aimee, thank you for being on the show.
Thank you so much for having me.
Tell us a little bit first. Health coach, but a focus on health literacy. How did you get into this field?
So, I have been a physical therapist now for over a decade, and it's just kind of been a progressive decline on really the amount of education that people have coming out of the hospital, even coming from their doctor's offices about really what they're dealing with medically speaking. And a couple of years ago, I sat in the living room of a lady who had had Parkinson's diagnosed a few years before that, but just asking her my normal routine questions. And she stops me and she says, "What is Parkinson's?" And I'm like, "Wait, what? You've been diagnosed like 2 years ago. Why don't you know this information?" And either there's a couple of options there. So one, either no one ever bothered to explain it to her, or two, they explained it in a way that went in one ear or out the other, right? Or she didn't understand it
Hmm.
the way they decided to explain it. And so I ended up sitting with her for the next half an hour and explaining to her, what is Parkinson's? What part of the brain is it affecting? Why are you seeing the symptoms you're seeing? And what does that progression look like for you? And at the end of all of that, she's like in awe. She's like, nobody has ever sat and explained anything medical like that to me ever. And she was just so grateful for that information. And the sad part about that is that had she had that information 2 years before that, she may not have been in the functional situation that she was at that time. She didn't know what she was dealing with or how to combat it.
Oh my goodness. So imagine 2 years without this information and trying to navigate her own chronic illness or chronic disease. And finally, she has information that can help her slow down the progression of the disease or help her manage her life around the disease.
Right.
Wow. And
It makes a
that
massive
is,
difference for people.
yeah, it does. It's huge. So there are quite a few chronic diseases that we hear about a lot lately, like type 2 diabetes. I keep seeing more increases of that. Um, and I was thinking dementia right now too. Cognitive disruptions and things like that, dementia and other things like that that we're hearing a lot more about. And is this prevalent across the healthcare system? What are you seeing in terms of health literacy needs when it comes to chronic diseases? And what are the top ones you're seeing out there?
For sure, for sure. It definitely is. So 60% of the adults in the US have at least one chronic disease, excuse me, 40%. 60% have at least two or more. So, chronic diseases are diseases that are, or ill diagnoses that you have that are going to be like a prolonged, either for a long period of time or indefinitely diagnosis. So, we're talking things like heart disease, diabetes, autoimmune disorders, neurodegenerative disorders like Parkinson's, Alzheimer's, that type of stuff. And actually, some of the research out there now is even labeling, particularly for people that are diabetics, like things like Alzheimer's are like type 3 diabetes, basically,
Mhm.
because diabetes, because of all the degenerative changes that occur in the body with those elevated blood sugar levels, eventually leads to the changes in the brain that cause that cognitive decline.
It's interesting because I have been seeing a lot of that. Even as a caregiver, my father passed away from complications from dementia, but he was a diabetic who then developed dementia. There are
Mhm.
other things behind that. I'm seeing that with other relatives as well who are diabetics and are developing
Right.
dementia or other
Right.
diseases. So I think that's one of the top ones that scare us the most, diabetes, because we keep hearing about how prevalent it is, but also other complications that come from it later in life.
Exactly. Exactly. Yep,
Very
and so particularly with diabetes, you also as those sustained high blood sugars happen, you end up with issues with neuropathy, not, losing that feeling in your feet and your hands, for example. The moment you get an diabetic ulcer on your foot, you are like 10 times more likely to end up losing that limb eventually.
wow. So does
And if you
your
lose
work?
one limb, you're more likely to lose the other.
Oh, wow.
Usually
Statistically,
within 2 or 3 years of losing one leg, you end up losing the other leg if you
so
survive that long.
how do we prevent that? How do we have a chronic illness or disease and prevent some of these potential outcomes like losing your limbs or having
So it
diabetes lead
really
to dementia?
comes down to health literacy. If you don't
Mhm,
know what you're dealing with or why the things that you're seeing are happening, then you don't have the ability to do anything about it. And so let's say you're a diabetic, newly diagnosed diabetes, or maybe even pre-diabetic.
mhm,
You're just going on about life like it's normal. And, you get your prescription and they're saying, take this, metformin, and everything's going to be fine, go on about your life. They don't even have a lot of people that are on metformin even checking their blood sugars. And so, you're just thinking, oh, well, my meds are going to take care of everything. I can continue to eat and do what I want. Right. Unfortunately, if you do that, it makes it so that that medication then needs to be increased or have an additional medication, or eventually it leads to all roads lead to insulin if you're not
mhm.
doing anything about it. And so, really, it comes down to lifestyle changes and understanding what you're actually dealing with, and then dealing with it and making those lifestyle changes that are in a sustainable manner, something that's going to be that ways that you can manage it without it being excessively restrictive and to maximize that quality of life.
Yeah. There are two things that popped up in what you were saying in my head. So one is the sustainability part, because a lot of us are like, "Whoa, I could eat chicken breast and broccoli every day for the rest of my life." That's not really sustainable.
No, you
And
can't.
yeah, I know. Well, let's talk a little bit about that. What are some ways? And then I want to talk about the data part, how to inform your doctors. That's what I was thinking of what you're
Right.
doing. But sustainability. So, okay, so let's say I'm diagnosed with a chronic disease. I need to make some lifestyle changes. How do you help your clients, your patients, in terms of the health literacy component so they can make this sustainable? How do we make this sustainable?
Right. So I do actually approach it in a couple of different ways. So I have an entire section of the program that I offer in the actual diagnosis education. So, like, what is diabetes, for example, or heart disease, or the autoimmune disorder like rheumatoid arthritis, or whatever it is that you've got. And so that you actually have an idea of what that diagnosis means, what are all of like the medical stuff around that, and so that you have an idea of what you're actually dealing with. But then I also go into the 16-week program that I offer, goes into how to nutritionally, how to eat right, so that you're eating in a way that you don't have to sit there and count your calories and, count all these different things every time you put anything in your mouth, right? Because that's not sustainable. You're going to eventually be like, I am tired of writing down every single little thing that I eat, right? And counting all these calories and counting all these carbs and counting all this stuff that's not sustainable. So I teach you basically how to eat in a way that is more of a balanced meal that is going to get you the nutrients that your body requires to function optimally. I also teach you about physical activity in a couple of different ways, more of like an introduction to move your body. And then also beyond that, like more into the resistance and strength training side of things. We talk about sleep and stress management because that has a huge impact on how your chronic disease trajectory is going to go. Chronic stress is massive for a lot of people. And we also talk about, medication management. Most people, I walk in their house as a PT and they don't even know half the medications they're on. Some of them are on a list of like 35 different things. I'm like, I don't even know how you keep track of all of those things, first of all. And they don't know what any of them are for. They're like, oh, well, they told me to take this pill. And so it's in my Medi planner. They don't know what it's for. They don't know how to monitor that, right? We also talk about how your mental health and your physical health are going to impact each other as well, because with a lot of chronic diseases, that depression factor ends up setting in because you think that your life is over, and it's not. You can live a really long time with most of these chronic diseases. It may not be pretty. depending on how you manage it, but you can definitely live a long time with them. And so, having that quality of life is huge for a lot of people. And as our population ages, our baby boomers are getting into their, 60s, 70s, that age range. And, more people closer to my age, I'm almost 39 at this point, and we're getting to the point where we're going to have to start taking care of our parents because they are now, having all of the, it's kind of a cumulative effect. They're having a climax of the disease process and
I've
having
been there.
to address all of those things.
Mhm.
So becoming a caregiver for a parent or a grandparent for that matter is also very stressful. And again, that chronic stress, if you're not taking care of your own self, then you can't be a very good caregiver in the first place. But then also, if you're not taking care of yourself, what you're taking care of with your parents is what you have to look forward to.
Yeah. It's interesting. Sustainability led to a few conversations now or ideas around creating habits,
Hmm.
determining what becomes sustainable. Then we dived into mental health for a little bit because I think a diagnosis can lead to depression. And then having to make lifestyle changes, especially if they're very dramatic for us, leads to, drives us deeper into that depression, and then trying to sustain those changes and try to understand what's happening. I think as we process that, all that could lead to depression. And then there's that point about self-care and also our own health. But if we become caregivers, what does that mean? And taking that time out for self-care and making it sustainable as well as part of that long-term plan. I think as part of the bigger formula, but all very important points that you brought up. So thank you for sharing some of those.
Sure.
Yeah, I've been in the shoes of that caregiver, and I'm still learning about self-care, everyone. I'm still working on it.
Same. Same. It is a continuous work in progress for sure.
Yeah, but so we talked about sustainability. There's another part, and you and I were talking about this earlier before we jumped on the interview. We're working with doctors. You talked about the lady with like 30 something meds, right? And what are they for? And I don't know. And I see how meds are prescribed to me sometimes, and I might not take them. I might, maybe it's not the right dose. Sometimes they have bad interactions. One doctor doesn't catch this thing that the other doctor gave me. The pharmacist didn't catch it, and then I'm in urgent care getting steroids because it was supposed to go together. So,
That's
so
right. That's right.
and then maybe there's something I could do differently with diet to prevent or to help with progression of a disease. So then there's that data point. So if I'm a patient, if I have a chronic disease or I'm trying to avoid pre-diabetes from becoming diabetes, for example, preventative medicine, my doctor doesn't know everything. My doctor only knows what I say in those 4 or 5 minutes I'm in the office with the
Hmm.
doctor, right? And there's a protocol. So it's blood work, it's this prescription, and see me in 3 or 6 months. How can we help connect the dots so that we're able to provide more data when we have the conversations, so we can work better with our doctors in this plan for sustainability and just to prevent a chronic disease or slow down that progression.
Right. So it is a really huge deal for a lot of people. They go in and expect their physician to just know everything that they're dealing with and be able to make a decision on the fly. Whereas for a lot of the cases, they need more information than that. And if
Mhm.
they're only seeing what your vitals or your blood sugar or whatever it looks like at that exact moment, without knowing what you're dealing with on a day-to-day basis, without that data points that you're talking about. So, like, if you're not checking your blood sugar every day, multiple times a day, if you're not checking your blood pressure multiple times a day, but you're having dizziness, or you've changed your diet, or whatever the case is for you, if you're exhibiting a new symptom, or you've made certain changes that now maybe you need medication adjustments.
Mhm.
Maybe you don't need the blood pressure medication that you're on anymore. I mean, your body changes. Even as you age, certain things change. Just because you've been on blood pressure meds for the last 40 years doesn't mean that that's going to be the same thing. Or maybe you don't need you need a different medication. Or let's say you are a diabetic and you're on like four different diabetes medications, but now you have changed changed a lot of your diet, you've started exercising, things are changing for you. And now you're suffering from episodes of low blood sugar. Well, maybe you're on
Mm,
too much meds, right?
yes.
You need to dial things back. But if your doctor doesn't have the data points where you're checking it and recording it and taking that in and saying, this is what's happening, this is when I'm having my symptoms, they're kind of walking into it blind, having to make a best guess
Yeah.
for you.
There's a thin line as you're talking about it. There's like this thin line between what you bring to your doctor for that doctor to make certain decisions and change something, whether it's a prescription or something else, versus while you're collecting this data, when do you make that change for yourself? Because you're not going to see the doctor for a few months. So, for example, if diabetes is what we're talking about, and I decide to cut back a little bit on my meds, on my pill, because I have these low sugar dips, because I am walking 4 miles every day and I'm eating healthier for my chronic disease. Where's that thin line? How do I manage that? The part where I kind of prescribe your milligrams versus wait for the doctor to tell me, but I'm balancing
Right.
this issue of the low blood sugar.
You have to be your own self advocate. You really have to be willing to speak up for yourself and say,
Mhm.
and even before you start doing those things, making those changes for yourself, talk to your doctor. Say, hey, guess what? I'm thinking about doing this. Is there anything I should know about my meds that can change if, I experience these things? But it's also a lot of the time people go to the doctor and they don't even know what to ask. Um, but and that's where someone like me comes in as a health coach. I tell you, you need to talk to your doctor about these particular things, get them to clear that for you. Say, let's say you have heart issues. You need to go to your doctor and ask them if what you're dealing with, it's okay for you to start an exercise program.
Mhm.
Maybe it's not, right? Depends on what's going on with you or what kind of issues you have. So, and everybody is different. So just because you are a person that has heart disease, you're diagnosed with coronary artery disease, doesn't mean that you are allowed to do the exact same things that somebody else with coronary artery disease is, because the the severity of that disease process is different for everybody. And what you're dealing with, if you're at 95% blockage versus 10% blockage, may be completely different.
Mm.
And so, really involving your medical providers in your decisions to change your diet or start an exercise program is very important. And also, just informing them, hey, I'm doing this. If I start to exhibit low blood sugar, what can I do?
Mhm.
Most people have access to some kind of my chart type of deal where they can message, some kind of patient portal where they can message their physicians or someone in the office at least to say, hey, I'm dealing with XYZ. What can I do about it?
That's a good point. I noticed
Most
that with
people don't do that.
Yeah, I think most of us don't notice. I didn't notice there was a chat feature for
Hmm.
the system that I'm using now with my current insurance. And I believe you can chat. I don't know how far that'll take you, but I believe they have a telehealth component now where you could jump
True.
into a meeting, schedule a quick meeting. And I haven't taken advantage of that. And that's
Hmm.
something that a lot of us might not notice. I don't really notice the little square with the little thing coming out that's for chatting, that
Right.
pops up on some of these apps when I go in to check my records or to make my appointment. And that's a
That's right.
place where I can ask some of those questions when I'm going through a health journey, right?
It is. It is absolutely. And then working with somebody like me as a health coach, I offer a one-on-one 16-week program where you have the ability to, like, if you need a question answered, you're dealing with something, well, what do I do? I can lead you in the right direction, tell you what questions to ask your physician. Because at the end of the day, your physician is the one that is in charge of your medications and they're the ones that are prescribing, right? I can't prescribe. I can't even tell you to take an aspirin for that matter, but I can help guide you in the best way to communicate with your physician and what you're dealing with so that they understand the symptoms that you're having and can help guide and can change medications on that front if that's what's needed, or having that clearance, right, to be allowed to participate in an exercise program, for example. Um, and so but having that continuous support of someone
Mhm.
who's been in the medical field for over a decade and has worked with people for over a decade with all of these different chronic diseases and understands all of that medical terminology. But I've been gifted with a way of being able to explain medical terminology, medical situations in a way that people actually understand.
Yeah.
A lot of times you go to the doctor and they use all these big long terms and say, you're like, well, what the heck does that mean? Or you get in my chart or your patient portal and you see on a report, oh, well, I have enlargement of my left atrium.
What
What
is
does that
that?
mean? Nobody ever told me that. What is that? And well, that is what I'm here for.
I'm guilty of looking at the lab work when it comes in because I don't get the call from the doctor's office to tell me
Right.
the lab work's in or what it means. So I go in and I'll look at the parts that are green and red, right?
Uh-huh.
Right? Uh-oh. So I'm always,
Right.
why is this red? And what does that mean? Let me Google these three letters and see if I can figure out what it is. Because you get the report, but you don't really have the information to understand all components.
Right.
And I think a lot of us do that with with a lot of the medical records. We have, oh, I have this, I have that. And you're like, well, what does it mean? As a kid, a doctor told me you have a heart murmur and it's a high grade. I didn't know what that meant. I forgot what that doctor told me. There was no adult who spoke English in the room with me, and I didn't translate properly. So none of us knew until I ended up in an emergency room for something else. And then it's like, hey, when you triage, you got to declare right away. I'm like, declare what? But yeah, you learn through the process, but there's so much we
Right.
could do now, and asking the right questions is important.
It is. It is. And the really sad part of the way our medical system works here in the US is that it really is all involved around why are you in my office?
Mhm,
Okay.
mhm,
You're here because of a checkup for your blood pressure medication. Your blood pressure medication is working great. Bye. Have a nice day. Or you need a refill. Or, you need a new prescription. So you're required to go so that you can get a brand new prescription, right? And so, it's all about what is that chief complaint, not about, what is actually causing all these issues in the first place. It's kind of the iceberg effect. We talk about they see, that surface symptoms and kind of like, let's treat that part of things. But
mhm,
then you've got this whole mass of ice under the surface, right? And all of that is the root cause. If you're not addressing any of that, it doesn't matter what you're seeing on the surface. None of that's going to change if you don't address all of that under the surface. So that is one reason why I go about my program as a whole person approach, talking about the disease itself, but also the nutrition,
mm,
the exercise, the mental health, the stress and sleep management, all of those different components. Because if
mhm,
you're not treating yourself as a whole person, you're only getting treated as a diagnosis. And then it leaves a lot to be desired for sure as
mhm.
far as the care goes.
Yeah, I think I like that whole person approach for healthcare because a lot of things are interrelated. But looking at the iceberg comparison, right? There we treat the symptoms, the stuff on top, and that's great. We resolve that problem, but something else is going to pop up because there's this whole mass of stuff going on underneath the surface,
That's
and
right.
we don't get to address that. And that's been my experience as a patient, that we tend
Right.
to address that part. Um,
Right.
we have a little, we're almost running out of time for our interview, and I want to touch upon one more thing before we close, and it's preventative medicine. I know we're talking about health literacy for chronic diseases, but in our conversation, I also started thinking about, so many of us know that we have, um, genetically we might be predisposed or it might be hereditary to certain things, and we want to do preventative work. So for example, for me, it's diabetes, dementia, and heart disease. A lot of my family members might, get clogged arteries, and no one is going to perform these tests on me because I'm not showing symptoms yet when I go
Correct.
into an office. So when looking at chronic diseases and trying to be preventative, knowing that we see a lot of this in our families, what do we do? What questions do we ask? How do we advocate for ourselves, especially if we start feeling that something's off, but no one wants to test us?
Right. So the best thing to do is to decide, you know what? Let's look at what do my genetics look like? So let's look at your parents first. Okay. So whatever they are dealing with, or your grandparents, if, depending on kind of how old you are, parents or grandparents, whatever they're dealing with right now, if you're doing nothing to address your own health and the way you're living, what kind of nutrition you're putting in your body, how much physical activity are you getting, how are you managing your stress to make sure that you're not like going to give yourself a heart attack at 25, you know, if you're not doing all those things, then whatever medical stuff your parents and grandparents are dealing with, that's what you have to look forward to because it's coming if you're not, kind of taking care of yourself now. And, maybe you don't even know what to do or where to start, right? You say, okay, well, I want to make sure that I don't get heart disease or I don't get diabetes because my grandpa just lost his leg because he's been a diabetic for all this time and he's not taking care of himself. I don't want to be there. Right. And so a lot of it, again, is just being that advocate for yourself and being willing to invest in yourself now. Spend, we were talking earlier about I had LASIK eye surgery a couple of
Mhm.
years ago. And like it's very expensive, right? I think it was like $4,000. Now, this has been a decade ago, so I don't know what the prices are now, but like $4,000 to get LASIK eye surgery, and best decision I ever made. Right? I haven't had to wear glasses. I haven't had to wear contacts, and it's like completely changed, like every morning for myself. So
Yeah.
compared to the 20 years before that, right? And if you're not willing to spend a little bit of extra money on yourself now so that you know how to eat, know what exercise to be doing, know how to manage the stress, and know all of those components so that you can maintain a quality of life and not end up in the health situation that your parents or grandparents are in, then that's what you have to look forward to is to, really end up there because genetics are going to take their toll if you're not doing other things to help circumvent that.
Yeah. I think that's a excellent point and great advice. Doing our own self-assessment, looking at our own genetics in this way of where are my parents, where are my grandparents, where are the chronic diseases they were dealing with. That probably will work its way down to me if I don't have a certain kind of lifestyle. And then where am I with my lifestyle and what do I need to change? And
Right.
that's mhm.
And then if you don't know, even you're saying, okay, well, I don't want that kind of stuff, but I don't know where to start right now. That's where somebody like me, as a health coach, comes in to help you, guide you in that way, and be able to teach you how to eat right, how to exercise and keep your body strong, be able to manage your weight, be able to manage chronic pain, be able to
Mhm.
manage your medications if you're on those, um, and really just understanding what these diagnoses actually mean. Like, how is it actually affecting your body?
Okay. All right. That's great advice and good information for anyone who's ever been interested in what is a health coach. Is a little bit different than a health coach that just focuses on nutrition or just exercise. We're talking about health literacy, and it's that added layer that's so important when trying to manage chronic diseases, when trying to navigate the healthcare system, when trying to prevent diseases from developing chronic diseases and trying to think about what kind of future you want. So, very helpful information in that area. Aimee, I've asked you a few questions and we had such a great conversation, but I wanted to see if there was any final thoughts or advice or anything else you wanted to share that I didn't get to ask you about.
Yeah, I would just say that don't wait.
Mm,
Be consistent and don't wait. If you were thinking, oh, well, I'm not going to worry about that right now because I don't have to deal with it. But if you don't worry about those things now, you're going to have to deal with it. So we talked earlier about, the golden years, your retirement years. And everybody thinks that, you retire and this is going to be this, a great time where you don't have to work anymore and you're going to have money to be able to go places and do things. But if you're not taking care of yourself right now, all of that money is going to be reserved to pay your medical bills. And you're also going to be feeling like crap and not well enough to go anywhere or do anything. So take care of yourself now so that you can have that quality of life when you get to retirement age. Spend that little bit of money now. Even I offer payment plans for that matter. So
yeah,
if
and
you
time.
need,
And
Yes,
spend that
right.
time
And
now.
have that time and take care of yourself now and learn how to do that now so that you can manage all of that stress of life and not end up with all of the medical issues later on.
Yeah, and I think that's a big lesson I've been learning is I keep putting off health, exercise and other health things in lieu of projects and work. And I've always been very task oriented, but those
Mhm.
tasks are the ones that fall to the end of my to-do list. So I think today's conversation is very helpful in helping us think about how to prioritize or reprioritize what we're focusing on in life and what we're doing each day, those
Yep.
tasks each day. So
And if you don't block out the time that you need for that personal care,
yeah.
you're right. It gets put on the back burner and things just accumulate and build on top of it and it gets pushed and pushed and further to the back, right? So the best way to be able to be present for your family, be present for if you're a caregiver for your parents or grandparents, be present for your kids. You have to fill your own cup first. If you're working with an empty cup, you don't have anything to pour into other people except for negativity, drained, stress, bad. When
Hmm.
you fill your own cup first and you're taking care of yourself first, you have more energy, you're less stressed, you're happier, everything goes better. You
Yeah.
can be more present.
Yeah. It's an analogy I've been embracing more lately of filling your own cup because I'm always focusing on taking care of everyone else. This person needs this person needs that. And just focusing on my cup can be selfish. So I love that you ended with that advice because it just reiterates that it's not being selfish. If you take care of yourself, fill your cup, you're able to help others and do all the other things you want. And that's the
That's right.
approach I'm trying to embrace.
Yes, it is not selfish. It is essential because if you
Mhm.
aren't taking care of yourself, there's nothing left to pour into other people. You're
Yeah.
more able to be present with your family, be present with your friends, be present at work, in every little thing that you want to be able to do if you're taking care of your own self first. There is so much more of you to give.
Yeah, I agree. Agree. Thank you so much for all the advice and information today, including those final thoughts.
Absolutely.
Tell us how we could reach you. This will be in the description of the episode, by the way, to everyone listening. But I thought it would be great if we share it here as well.
Yes, for sure. You can find me on Facebook. I'm also on Instagram. You can find me on my website, camphw.podia.com. You could also call or text me at 502-208-5879.
Thank you so much. Thank you for being on the show and for all the wonderful advice. It
No
was a
problem. Thank
pleasure
you for having
having you.
me.
Yes, thank you. Thank you. And to all our listeners, thank you for listening to this episode. I hope you walk away with some strategies in thinking about how to slow down the progression of chronic disease or how to prevent chronic disease if you can, and how to work with the healthcare system through health literacy. So, Aimee, thank you for sharing your expertise with us today. And thank you all
Absolutely.
for being part of Coffee and an Interview.